Good afternoon, evening, and early good morning to the Honorable Ministers, Excellencies, our Honorable Minister for Health and Family Welfare. I would like to acknowledge esteemed participation of the Honorable Ministers, Excellencies, and dignitaries who have joined us today for the Health Ministers session of the second Voice of Global South Summit. The theme of this session is Solutions from Global South for One Health. We shall begin the session by playing a short video showcasing key outcomes of India's G20 presidency, followed by the introductory remarks by the Honorable Health and Family Welfare Minister of India, followed by the remarks from each of the Honorable Ministers, Excellencies, and esteemed dignitaries. May I now request the Consul to play the video on India's G20 presidency. Thank you.
This Voice of Global South Summit is a collective effort for gaining noble ideas for our collective futures. India's G20 presidency has tried to give a voice to the Global South.
सबका साथ की भावना से ही भारत ने प्रस्ताव रखा था कि अफ्रीकन यूनियन को G20 की स्थायी सदस्यता दी जाए।
Enhance action on commitments under the UN Climate Convention and the Paris Agreement. This will be crucial in helping the Global South fulfill its development aspirations in a climate-friendly way. I strongly believe that it is our collective responsibility not to let the sustainable development goals fall behind. We should find solutions to address the debt risks faced by many countries. We must find ways to build sustainable and inclusive food systems. Our vision of One Earth, One Health envisages good health for the entire ecosystem for humans, animals, plants, and the environment.
When women prosper, the world prospers. Their leadership fosters inclusivity and their voices inspire positive change. We can advance financial inclusion and productivity through digital public infrastructure.
Scaling, reskilling, and upskilling are the mantras for the future workforce. Respond to the priorities of the Global South by framing an inclusive and balanced international agenda. The voice of the global south needs to set its own tone. Together, we need to escape the cycle of dependency on systems and circumstances which are not of our making.
I now invite the Honorable Health and Family Welfare Minister of India, Dr. Mansukh Mandaviya, sir, to inaugurate the session and deliver his opening remarks. Sir, over to you.
Excellencies and distinguished colleagues, Namaste. I extend a warm welcome to you for the second Voice Global South Summit. Under the overarching theme of second Voice of Global South Summit, together for everyone growth, with everyone's trust, we have gathered here to resolve to come together amidst the unprecedented challenges facing the countries of the Global South. Excellencies, during the G20 Health Ministers meeting held under the India's presidency in Gandhinagar, Gujarat, on 18 to 19 August 2023, major global health priorities and challenges were discussed, building upon the momentum generated by the first Voice of Global South Summit. The Ministry of Health and Family Welfare, India, identified three key health priorities, that is, health emergencies, prevention, preparedness, and response, strengthening cooperation in the pharmaceutical sector, and digital health innovations and solutions, which reflects a continued commitment to addressing the unique challenges faced by countries in the Global South, thereby infusing inclusivity in global health discussion and solutions. I would also like to emphasize our commitment to seeking reform of global governance structures to make them more responsive to contemporary realities and global challenges of the 21st century, especially the needs of the Global South. Excellency, the theme of this session is Solutions from the Global South for One Health. Today, the One Health concept is recognized as an effective approach to complex public health problems involving multiple disciplines closely linking human health, animal health, and environmental health. It is imperative to recognize that the majority of epidemics and pandemics threatening global health, from severe acute respiratory syndromes to COVID-19, have roots in genetic origins. Committees of the International Health Regulations have consistently highlighted the inadequacy and fragmentation of efforts, leaving populations vulnerable to fend for themselves. It is also deeply concerning that the ongoing crises have exacerbated unequal access to healthcare and education. Hence, It is necessary to reverse learning loss and transform education and implement the One Health approach, enhance pandemic preparedness, and strengthen health systems. Excellencies, I would like to take this opportunity to apprise you of the initiatives undertaken by the Ministry of Health and Family Welfare, Government of India, to address the concept of One Health. National Center for Disease Control is at the forefront of significant One Health related endeavors, implementing programs grounded in One Health as a fundamental principle. India's One Health programs diligently monitors and investigates emerging infectious disease, particularly those originating from wildlife species, with a focus on fostering coordination among diverse groups for early detection and response. In addition, India has launched National One Health Mission, adopting an integrated approach that observes the interconnected aspects of humans, animals, and the environment to monitor and prevent diseases. This mission also facilitates coordination across various ministries and departments, aiming to achieve comprehensive pandemic preparedness and integrated disease control against priority disease in both humans and animals. There is a pressing requirement for a collective emphasis on bolstering resilience across our economics, societies, healthcare systems, education systems, and infrastructure. Additionally, it is also crucial to acknowledge the central role of women in sustainable development, and therefore we remain steadfast in promoting women-led development. We also understand that the digital public infrastructure is a promising tool for propelling public health initiatives in the global south. Digital platforms, networks, and services have the potential to play a pivotal role in tackling healthcare challenges and fostering equitable access to medical resources. Excellencies, under the dynamic leadership of our Honorable Prime Minister Narendra Modi ji, the New Delhi Leaders Declaration of the G20 Summit, India has underscored its unwavering commitment to the implementation of a One Health approach. This commitment is demonstrated by the emphasis on the One Health based approach in the Leaders' Declaration. Furthermore, there is a dedicated focus on prioritizing efforts to address the critical issue of antimicrobial resistance, including research and environment, infection prevention and control, as well as antimicrobial stewardship efforts within respective national action plans. Excellencies, let's underscore that collaboration is not just an option, it is a necessity. As we progress, let's steadfastly uphold our commitment to the One Health approach in harmony with India's cultural ethos of Vasudhaiva Kutumbakam, signifying the world is one family and emphasizing the interconnectedness of all lives. Our combined efforts should be directed towards nurturing collaboration, trust, and growth in the global south. Acknowledging the significance of the inclusive and sustainable solutions to address the challenges faced by nations in the global south. Thank you. Thank you very much.